Welcome to the Healers Café, conversations on health and healing with Manon Bolliger, a retired and deregistered naturopathic physician with 30 plus years of experience. Here you will discover engaging and informative conversations between experienced healers, covering all aspects of healing, the personal journey, the journey of the practitioner, and the amazing possibilities for our own body and spirit.
So welcome to the Healers Café. And today I have with me Ron Phelan. And just to give you a little bit of background, he's been involved in natural therapy industry since the early 90s. He's been trained in various remedial massage techniques and also more biofeedback therapy. In 1996, Ron trained in the Bowen style of work from 1998 and has practiced Bowen in, is it Geelong or Geelong? You'll correct me anyway, region of Australia, where Mr. Bowen worked for 26 years. And Ron has had the opportunity to work with other students of Mr. Bowen, as well as treating his original patients. So Ron and I met, I'm trying to think how long ago that was. It was a while ago.
2009, I think.
When?
2009, I think.
2009, okay. And and we've been doing the Bowen thing and internationally and inspiring people to look at this simple therapy that has just huge results. So anyway, I'm really thrilled to hear specifically one of the big influencers in your practice, and then how it influenced you to work more on the TMJ and all that. So I'm going to leave it to you, Ron. So welcome and thanks for taking the time to share your knowledge with us.
Oh, always a pleasure to catch up, Manon. Thank you for the opportunity to have this connection. I guess very briefly, I probably should start off by saying my initial background was electronic engineering, and sort of coming through that sort of a science type background, which I've always been an inquiring mind, and I like to know how things work, and to I guess to that end, that when I got into body work, that concept or that type of thinking, asking why, came through into the bodywork side of things. So as you mentioned, I've been practicing in Geelong since 1991, end of 91, and when I studied the Bowen back in 96, I certainly started treating people here in this area in Geelong, and so it was quite an interesting feeling having people come in and you say, oh look, I'd like to try this other therapy, it's called Bowen, and they say, oh, I used to go to Tommy Bowen, he fixed me in one go, and you think, oh, okay. So it sort of put a little bit of pressure on you, but through the Bowen journey, I was very fortunate at the time when I started using the Bowen in the mid 90s, that two of Tom's students were still practicing here in Geelong, and one of those, Dr. Kevin Ryan, who's an osteopath and the last person to learn from Tom or observe from Tom. I ended up being a patient of his for about 3 years, and I certainly noticed that there was lots of differences in the way he approached the work compared to what I'd been taught. And then also I met the other gentleman who still practicing and is still currently practicing, in fact the only one of the 6 that's still practicing, and that's Dr. Romney Smeaton. And Romney invited me to observe him in 2002. So I used to go into his clinic every second week, and for Tuesday morning and watch him work. Did that for 18 months or so, and asked him questions. And once again, his version of the work was different. He was a chiropractor, as I mentioned. Dr. Ryan was an osteopath, so they had a different philosophy, a different approach. But probably out of the two of them, they were more similar because they would get together and cross-fertilize ideas and discuss, observe Tom do. And I also through the opportunity of spending some time with the lady who worked with Tom right from the very start back in 1956, 57, and spent 4 years with her before she passed, and just learned a lot about the development of the work, the history, and some of the anecdotal stories that she told me. It was just really, really quite heartwarming to hear about little kids, getting up and walking that never been able to walk before. So out of the 6 of the original students of Tom, I've had the opportunity to meet 5 of those, and had treatment from 4 of them, and then training really from 3. So my interpretation of the Bowen has really been a bit of an eclectic mix of what I saw and experienced through these other people. And as you do, you develop your own little approaches along the way as you come across situations that may not resolve in the manner you anticipated. So you have to look outside the box. And I guess that's where the engineering brain came in. And so, well, how do I approach this, and work out a way to find an end result? So moving forward, 2007, I was teaching a style of Bowen, which was only taught to qualified practitioners from about 2001. And that, in working with qualified practitioners, RMTs and osteos and chiros and physios, that they weren't just happy to accept that this was going to work. They wanted to see a quantitative output of the work, and wanted to see that what you're saying was going to work. If the lower back procedure was going to produce a change in the lower back, they wanted to see that. And so I was asked, or I guess during teaching those years, I would introduce some of the assessments that I'd learned as an RMT, and then other things that I'd sort of developed myself, and started to show people, okay, this is what it looks like now. This is what you do the technique, and this is the outcome. You can see the difference. And then I was asked to teach a workshop to cover all of the Bowen procedures that we use. So I did that, and that became a separate workshop. And that included the temporomandibular joint, which was part of the Bowen suite of protocols. And then another event happened in 2000, or actually happened before that in 2004, where I met a orthodontist in the US, Dr. Brendan Stack, and I was taken to his clinic in just on the corner of Washington, DC, called Tyson's Corner. And I went to his clinic and observed, I met him basically, and we got on really, really well, and he gave me some notes, and we talked about different things, and he was very encouraging of what I was trying to do, which was at that time to put a presentation together on TMJ. And it was quite an interesting, I really had no idea what to expect, because it was an orthodontist, and I came into this room, I was sitting in the waiting room, and sort of people are coming in like in wheelchairs and sort of all sorts of physical dysfunctions, and they were walking out, and I remember walking out, looking at the front door, and it said, Dr. Brendan Stack, DDS, etc. I'm thinking, it doesn't say faith healer here. What's going on? And so he explained to me sort of very basically what he was doing, and then he gave me a whole bunch of notes, and I was presenting in Canberra the following year at a conference, massage conference, and I thought I'll focus on the TMJ. And he gave me an old VHS for those who remember what a VHS tape was, and to play. And it had a whole bunch of case studies that he'd worked on. So I went back in 2005, met him again, and he looked at what I had put together to present, and he made a few little changes, and he gave me a DVD of the case studies, which made it easier to present that. And I did that presentation in 2005 in Canberra, and much to a lot of astonished looks on people's faces that by adjusting a jaw, you could make this a significant change to the body. Moving forward, and this has sort of coincided now with the assessment courses, that I started teaching the assessment course in both Australia, New Zealand and UK, and then I got an invitation from Dr. Stack to attend one of his workshops. Now, as a body worker, body workers don't get invited to orthodontic workshops. It's just, you have to be a dentist or an orthodontist to go to an orthodontic workshop. But for some reason, he invited me, and I received this email, and I thought, what do I do here? And I thought about it for a while. I really didn't know what I would learn being a body worker, and whether I'd even be able to comprehend what was being spoken about, because the terminology that's used in dentistry is very different to normal anatomy and physiology. And I went along to the workshop, not really knowing. I thought it was a great opportunity to catch up with Dr. Stack again. And that was really the game changer, because Dr. Stack talked in more detail about what he was doing and how he achieved it, so other dentists and other people in the room could understand his approach. And so that was a workshop. It was a couple of days in Washington, D.C., and ended up with a whole bunch of notes and a couple more videos.
And Ron, what just to clarify, his understanding of how the jaw works is not necessarily one that is understood or seen by other orthodontists, right? He had a...
Well, yeah, it's a good question, because he said to me that the principles that he was using were taught to him as an orthodontist. And he studied dentistry in the 60s, I think it was, and then he did his orthodontic work after that. So he was quite astounded, and he made the comment that this concept was taught in dentistry, taught in orthodontics, but the principles wasn't being used by many people. And subsequently, what happened, I spoke to people here in Australia asking about that as well, and they said, "Oh yes, that was a big thing in the 80s. Everyone was trying to do that, but it didn't give the desired outcome. So it sort of lost favor." And the reason that it didn't give the desired outcomes is because they weren't actually hitting the mark. They just weren't getting it. And Dr. Stack had been doing this for like nearly 50 years. So he was very experienced. So he would make an appliance to align the jaw in the position that the body required it to be in. And that's really the difference. So I fundamentally, that was the concept. But what Dr. Stack's approach was, he said, forget about the teeth. The teeth are not, they're secondary to the jaw. His approach was, if somebody came in with a dysfunction, he would look at their teeth, obviously, look at their jaw, take MRIs and X-rays, and then say, right, the jaw's in the wrong position. This is being caused, in many cases, by the teeth. So therefore, we have to remove the teeth from the equation. So in doing that, he would make a splint, and that would clip into their lower, usually the lower jaw. And then when they were biting down, they would bite into the splint rather than to their teeth. So their occlusion now was not defined by their teeth, but by the splint. So in doing that, it would put the jaw back into its ideal position. That would immediately remove the symptoms in most cases, or certainly over time. And then as the jaw healed and stabilized, he would be altering the appliance because the healing would change the dynamic of the jaw compartment. And that in turn would, if the splint was made for, the January, and now we're looking at the March or the April, then that there would be some changes. So he would have to alter the splint accordingly. But if the teeth were noticeably in the wrong position, he would put braces on and then start to move the teeth to where the teeth should be to maintain the jaw position. So that was really, it's so basic that it's sort of like you wonder why it's not a concept that is being used in dentistry. And
you described it with with a hinge, and it was a farming. You had a
gate, that was
that most people are looking at the fence post as the teeth, wanting that to be straight, whereas he was going, well, we got to get the hinge in the right position, and then the rest will work out, or something like this, right?
Yes, that was for that conference we did in 2015 with Dr. Stack in the UK, and I was walking through a field in Yorkshire with my friend who you'll meet in a few months, and I was looking for an analogy, and there was this farm gate, and like a lot of farm gates, we've all walked through a farm where you undo the latch, and then you have to sort of lift the gate to open the gate, and then go through and put the latch back on. So what's happened is, the hinges are representative of the TMJs, and the latch, in this case, is the teeth. But in a farming gate, there's only one tooth, one upper and lower, if you like, the connection. Whereas in a human, we have up to 16 latches because we're designed to have 16 teeth in the uppers and 16 in the lowers. So if the hinges are not perfect, then what's the chances of those 16 latches all meeting in unison and stabilizing it? It's almost impossible. So the hinges are the primary, and as Dr. Stack said, the teeth are not important initially, because the teeth can, in many cases, be causing the issue, because when you bite down like that, the teeth will ultimately dictate the jaw position. And so therefore, if the teeth are misaligned, then that's going to put the stress back onto the jaw. And like every joint in the body, and every part of the body really has a range that it will function within quite happily. But when you go outside that range, what we call the physiological adaptive range, then you become symptomatic and you become dysfunctional, and in many cases for TMJ, it becomes pain. So that means that a lot of the things like lower backs and problems can be coming from the jaw. In fact, the work we're doing in the UK, I was working in the UK for 7 years in a dental clinic, and in amongst my teaching commitments, and we were finding there that about 3/4 of people with TMJ dysfunctions, 3/4 of those, the TMJ was causing problems throughout the body. Only 25% was that, say, the pelvis was causing the TMJ to be out. So that primarily means that there's a large number of people, and I think it was around about 85% people coming into the dental clinic had some form of TMJ dysfunction, and of that 85%, 3/4 of those, the TMJ was causing problems down in the body. So many times, people come in with all sorts of other ailments, and just by adjusting the teeth and getting the jaw back into the right position, those ailments would go away. And these people had tried, all sorts of other treatments to try and get rid of it, but they were treating the symptom, not the cause.
Manon Bolliger here, and I want to thank you for taking actionable steps towards engaging your healing journey and helping others discover their path by watching, sharing, subscribing, and reviewing these podcasts. Every review and share helps spread the word, these different perspectives and choices and options for healing. And to thank you, I'd like to invite you to sign up to my free 7-sequence email tips on health and healing for everyday life. You can go to healerscafe.com tips. Thanks so much. Right.
So, yeah, so I after doing that course with Dr. Stack in 2008, I came back to Australia and I wrote to him and said to him, who can you recommend? And here in Australia, and really it was only one person who'd taken his training and was on board with that. And that's a gentleman out of Sydney who also spoke at that conference in 2015. And so I contacted him to sort of start connecting with him, and that subsequently, out of that, I ended up presenting to his dental group in 2011 about the approach I was using. And so in 2008, I came back. I had no idea how I was going to find this ideal position, because Dr. Stack was using MRIs, X-rays, and all sorts of interesting equipment to find out where the jaw position was, and then how to what size appliance to make to bring it back into its ideal position. But I didn't have access to all that equipment, and it took me about just over 2 years of trialing different methods. Once again, the engineering, analytic brain kicking in, saying, well, okay, this is what you're trying to achieve. How do we do it? And I eventually figured out a way. I was a bright light came in my treatment room one day, and I went, "Oh, this is interesting." And but a lot of things went into the waste bin in the meantime. Trialing different things. But so about 2010, I finally found the way to I find this position, and but so different with Dr. Stack. He was using appliances to hold the jaw in that position, where I didn't have that option either. So I knew once I found the position, I thought, well, that's pretty cool. That's doing what I anticipated. But what I hadn't anticipated was when you do the Bowen moves, when the jaw was stabilized in this position, then and the stabilization was a temporary stabilization. So like it was using like tongue depressors to find this jaw position. Once you did the Bowen moves with the jaw in that position, you could remove the stabilizing sticks. In most cases, probably 70, 80% of the time, the benefit was still there, the advantage of what you'd done. So my understanding of that is that it widened this range, this adaptive range, but it not only did it for the jaw, but because it was descending patterns, like problems from the jaw going down through the rest of the body, pelvises would change, and internal, external rotation of the hips, and all sorts of things would change. And that's after the Bowen correction had been done. So the two together, the concepts that I learned from Dr. Stack about the correct jaw position, along with the Bowen moves, just made them have an amazing outcome.
Well, I can certainly speak to that from, I mean, that, I had learned the basic TMJ, and, it's like, you don't know if you've put it in the right position, but you knew in retrospect if it helped the whole body, but
Yes.
you can't know in the moment because we had nothing to base it on. Right. And then after your methodology, which took me a little while to, because I work very intuitively, so I could never teach that, but I got it. I understood what you were doing, and then it changes everything. It's just like once the body knows that this is it's almost like it recognizes this is the right position. Now it's not in fight and flight. It's comfortable, and we're programmed to heal, right? So it seems like from there, not only would it last, week after week, but it allowed so many other parts to to self-correct without having to do anything specific.
Oh,
So
exactly.
quite
Yeah,
amazing.
that, to be honest with you, that was the part I probably hadn't even thought about that part. I was very much focused on getting the position right and hadn't sort of considered what the long-term effect would be not having a splint. And I had not anticipated the power of the Bowen moves in conjunction with that. And as I said before, it not only changed it for the jaw, but it changed it for the rest of the body. And and I like all types of body work. Sometimes it needed 2 or 3 goes, depending on what the circumstances were. I often find I'd say between 1 and 3 treatments is usually what it takes. But I've had situations where the most powerful results I've ever had in nearly 30 years of practicing has been in classes where people have come in, practitioners have come in with all sorts of issues, because the practitioner is supposed to be perfectly balanced and healed, and sometimes I look at the practitioners in the class and I think, okay, you don't look that healthy. But and just a couple of examples of that was where a lady, 2013, so 10 years ago, in England, and she attended the class with her right eye immediately rotated by about 5 or 6 degrees, and and so when you're looking at it, you didn't know which eye to be looking at, which one was the straight one, which one was the when she was turning and looking at you. But she had a correction done, had a massive reaction to it, and she was a bit sort of shell shocked by it all. We got her into the tea room, got a cup of tea into her, and she stabilized. And she came into the room 10 minutes later. We were waiting for her, and she just said, I've come out of the cubicle, I went to the bathroom, came out of the cubicle, went up to wash my hands, and my eye is now straight. And I didn't know. She said, she got kicked in the head by a horse. I think it was 22 years earlier. She had all sorts of treatments. She came out, went to wash her hands, looked in the mirror, her eye was straight, and she had her right-hand peripheral vision, which she hadn't had for 22 years. Now, driving in the UK, as in Australia, we drive on the other side of the road. The right side's your really important side to be able to see out of. And not to have your right peripheral vision for 22 years must have been very difficult. And now that was 10 years ago, and she's one treatment, and I didn't even do the treatment. I just made sure the jaw was in the right position, and she stabilized. That's corrected it, and it stayed that way for 10 years. And there was a case in Germany where a lady, she had her atlas was out, and what also happens with the jaw is the jaw being part of the cranial system, because the jaw is sitting articulating with the temporal bone. The temporal bone articulates with the sphenoid bone, and any movement in the sphenoid bone, all the other bones in the cranium have to adjust to compensate, and that relates also back through to the atlas axis. So we find that a lot of old issues can have atlas axis issues which don't get, and usually will not get corrected through your normal Bowen moves, or certainly not as powerfully. And she'd broken her leg when she was a kid. She was in a plaster, 6 weeks, physiotherapy, and she couldn't swim properly. She said, when I didn't know this at the time, but I went to set up her jaw to correct the jaw, but the atlas was out and had to be corrected. So the atlas was corrected in conjunction with the jaw, and you have to do both at the same time, otherwise one will pull the other one out. And 2 weeks later, she wrote to me and she said, I broke my leg when I was 6 or 7, complete break, fibula, tibia, and I was in plaster. I haven't been able to swim. I couldn't kick my leg properly, she said. And after having the correction of the jaw with the atlas, she could now swim properly for the first time in 37 years. And that was, I didn't even know about this, it was like, this is just an outcome from, and it's not, I've had people write to me who've done the class and getting quite amazing.
Well, Yeah, one of the things you might not, because when you're teaching it too, I mean, there's also a group dynamic, where we come in all wanting to help others.
Yeah.
And secretly, though, we all desperately need help because most practitioners don't take the time, to get the care that they need. I think that's one of our main faults. But what I was going to say about what I noticed with this move in my practice, and it really helped me understand in doing Bowen College, that we have to understand the mental emotional aspects of what people go through. We are one whole being, and though this is physical, if you aren't prepared for the release, the traumas, the everything, like you're explaining, her leg got better. Well, it's jaw related ish, but certainly the trauma is,
Yeah. Oh,
and so it just brings such a depth of healing in this technique, which I just find, and this move in specifically, I think I've seen just so many things happen with just the precision of that move done right. It's really something. Yeah.
Yeah, well, that was the issue. The issue was the precision,
Yeah.
because I use the analogy of like a combination lock, and unless if you're turning the lock on a big safe and it's got the big dial there and you're spinning the dial around, you've got to get exactly the numbers in the right sequence, otherwise the lock will not open.
Yeah.
And that's what happens with this jaw position. You can be a hair thickness out and it won't open. It's just
Yeah.
won't. You've got to be exactly on it, and that's where Dr. Stack, God bless him, he was just so experienced at doing this.
Mm.
And I think when he did his training, he would sort of show them what to do, but he just knew, and he had that intuitive component, which you can't teach. It comes with experience and having an understanding, and I guess having that inherent ability that he could look at this appliance and go no, and just grind a fraction off it, and that would make the difference whether the person could walk or not.
Yeah.
And I guess with what I was able to, I guess, achieve was a systematic way of finding that is reproducible.
Yep.
From people taking a class, they take the class and they do it in the class, and they can take it back and they can use it in their clinic straight away. And last year, well, this has been going for a while now. It was about probably 7 years in the development. A good friend of mine over here, a lady by the name of Chris Freeman, she said, "Bron, you need a wall chart for this so people can follow what's going on and have it on their wall so they can look at it quickly." So we put together a wall chart
Oh, great.
for people who've taken the class.
Yeah.
This is based around more around the second day. It covers the first day primary work, and the second day of the TMJ class does a lot of assessments, and probably on just a little bit of an explanation there. The first day covers a lot of theory information explaining how the TMJ works, the pathologies behind it, and we look at case studies and things like that to give people a really good understanding of the TMJ. And I've had dentists take my class, and they don't know this stuff, so it's quite in depth. And then the second day, we move forward with those concepts, and what I wanted to show is how one move or one series, it's about 5 moves. If people don't are not aware or haven't taken Bowen training, I show them 5 moves, and within those 5 moves bilaterally, they can make a significant change throughout the body. So the second day, we're looking at all sorts of things. We're looking at hip positions, leg lengths, all sorts of types of potential dysfunctions, atlas axis issues, shoulder problems, and the participants are working in pairs, so they catalogue a complete overview of the body of that person or their partner on that day. And then at the end of the day, they'll do one little procedure, which in this case would be, say, 5
Right.
moves, and the primary move being the one on the jaw.
Mm-hmm.
And I would say 96% of the time, everything changes on that person. Everything balances out. And to be honest, I do not know of any other technique that can have such a profound effect throughout the body as the TMJ will have in that instance.
Well, Ron, our time is up,
Okay.
but I think it ends perfectly. And I this will play longer, but those who are interested, Bowen College will be hosting Ron, and this is now coming up in September. So the dates are all there. They'll be listed by this video as well. If you know them by heart, feel free to say so. I'd have to look them up. I don't want to misguide people. But it's really an opportunity to have you here, and I look forward to it again. So thank you, Ron. And really for inventing this move, putting this together,
Well, I'd have to thank Dr. Stack for his. He was the motivator, and I wouldn't have been aware of the concept had I not taken that class, and for him to invite me. So all the ducks lined up, and I turned up at that class, and as a result of that, yes, and it was just probably my inquiring mind that got me from the next step to come out with this, and wanting to improve what we were doing, I guess, and we were all doing things to help each other and help the world. The world needs a lot of support, and a lot of people dealing with a lot of stuff, as you said, not only physical but emotional. So this is certainly a great attribute to their skills. And I should mention that we like people to have about 3 years of experience before taking the class, so they're ready for it. They've had a lot of practice. They know what the standard work can do, and then they can see the benefit of this work. Yeah. So thank you for the opportunity to speak.
Thank you for joining us at the Healers Café with Manon Bolliger. Continue your healing journey by visiting thehealerscafe.com and her website, and discover how to listen to your body and reboot for optimal health.